The member from Ottawa West Nepean.
Thank you, Speaker. And thank you very much to the Leader of the Official Opposition for putting forward this important motion. This government is responsible for breaking our healthcare system, pushing it to the brink, and driving out nurses and healthcare workers with their incredible disrespect. And as a result, people in Ottawa, West Nepean, and around the province are suffering, waiting in pain or poor health for desperately needed surgeries. But instead of fixing the crisis, the government is now trying to sell people an illusion of access to care, while they break the public system even further and allow private, for-profit providers to step in and reap profits off of people's pain. But the government's so-called solution is a shaky house of cards that falls to pieces if you even look at it too hard. The government claims that we have to let private, for-profit providers into our healthcare system because the public system just can't do it anymore. But in Ottawa, we have operating rooms sitting unused and underused because we don't have the staff for them. There are over 500 vacancies for nurses currently at the Ottawa Hospital, Speaker, and without nurses, surgeries just can't happen. Among the operating rooms that are underused are the ORs at the Ottawa Hospital Riverside campus, which are not used on weekends. But in a deal that was just announced and that just started this past weekend, Speaker, these publicly funded operating rooms, located in a public hospital, are now being used by private, for-profit surgeons on weekends. Now, it's bad enough that people are being allowed to make a profit out of space in our public hospitals, Speaker, rather than those spaces being used to expand the number of publicly funded, publicly provided surgeries in Ottawa. But here's the kicker. When this deal was made, it was claimed that the surgeons would bring in all their own staff. They weren't supposed to be using the hospital's nurses or healthcare workers. Only the space was to be used. So this was adding capacity that the public system didn't have. But what happened instead? Nurses at the Ottawa Hospital are being approached in and around the operating room while they are on shift to ask if they will staff these private surgeries on the weekend. So much for bringing in their own people, Speaker. So much for the Minister of Health's assurances that her privatization plan would have no impact on staffing of the public system. What happens now when the Ottawa Hospital already has more than 500 vacancies and now nurses are being asked to take weekend shifts for private providers too? The minister's plan has never been about adding capacity. It is only about multiplying profits. The government should rip up this terrible plan, invest in our public hospitals, and recruit, retain, and fairly compensate nurses and healthcare workers so that people in Ottawa can actually get the health care they deserve.
That's right.